our group, the Muslim Health Consortium, has researched, looked into, and consulted regarding. Um, we are very happy to bring to you, after so many weeks, some very good news. We've said in the past that we've seen the light at the end of the tunnel. I can say at this time, alhamdulillah, that we have real good evidence to that effect. We have seen in the data that in all the states, all 50 states now, the number of cases is on the decline. So this is wonderful. We see that the number of cases has declined from about 800,000 cases of COVID per day to down about 375,000 per day. Significant drop. That means that we have gone past the peak of the curve and are now on the downside. We can see that the number of hospitalizations are down, but surprisingly, the number of deaths is still going up. And how do we explain that? Well, the number of deaths that we see in the statistics is like a lagging indicator. It's one of the last things to go down. It gets to the peak the slowest and goes over the peak the last and is the last to come down. So when we see the number of cases go down, the number of hospitalizations go down, we know, alhamdulillah, that the number of deaths will be following soon. So we also see that the number of the virus in the sewage is decreasing. Right. For those who are not aware, that we have been tracking in many places by taking samples of sewage water, wastewater, and looking for the coronavirus in that. And this tells us ahead of time when we're going to have a surge. And it also, by tracking it, lets us know when we have passed the surge and it is decreasing in the community. And we do see that going down now, alhamdulillah. It doesn't mean that our healthcare system itself is out of the woods. It is still being battered. How do we explain what's happening? We just want to leave three things and we'll turn it over to our colleagues. The three things are that we've talked about herd immunity in the past. That's when everyone in the population or a good number or a high percent of the people get immunity. And this can occur from natural immunity, meaning that they've caught the virus, the COVID, or from immunizations. But they have a level of immunity that's present in the population. This fights the virus. It doesn't transmit as easy. And when it runs out of places to hide or host to get, then it kind of fades away. So achieving herd immunity is occurring. The second is that we're now going into the spring and summer season. And as you know, in the past with colds and flu and all, this is when they go down. So this is viruses have a certain seasonality about them. And alhamdulillah, we're going into the spring and summer, and we expect this one to act accordingly. So we're looking for it to go down. And the third is we mentioned already the severity. It was in competition with a bad fella, Delta, and it was more nimble on its feet and it beat out Delta. And this was good. We were cheering for this one. But when this one won, and it turns out not to have the punch that Delta had, then that was essentially a blessing for us. So for all of these reasons, we are happy to bring this good news